Greetings. So in this video, we're going to talk a little bit about transplant and transplants and issues with them. So first, what are we trying to do with a transplant? So this is what happens. You have irreversible organ failure, and that leads to morbidity and mortality. Ooh, that's big. What does that mean? That leads to people that get sick and they die. People that are not productive and can't live their life to the fullest, and then they perish. Let me give you an example. After myocardial infarction, if the heart muscle doesn't get blood, that muscle dies and it becomes fibrosed and it's scarred. And that scar tissue is dead tissue. It's not functional tissue. So what happens? Well, the heart doesn't pump as well. Why does it not pump? Because the muscles that pump are scarred and they're not functional. So these patients have low cardiac output and they go into heart failure. They can't go for a walk. They can do activities of daily living. They can't breathe because they get pulmonary edema. Their heart has complications such as arrhythmia, and they are sick and they die and they are in a vicious cycle. So again, morbidity, mortality, sickness and death. Same with chronic kidney disease. What do you see? You see, just as with heart, you saw the cardiac function or the cardiac output go down. When kidneys get scarred over time, the renal function goes down. Patient goes into renal failure, like the patient went into heart failure with cardiac scar tissue related to myocardial infarction. See, easy. You have an organ, the organ function goes down because of some insult, the organ fails, and that leads to morbidity and mortality. Person getting sick and person dying, person is not productive and functional. It's not a good thing. So the thought is, can I transplant? The word transplant means, move it from one place to another. So the concept is, if I can replace a bad, failing organ with a good organ, I have a good organ. So I'm no longer in organ failure, which means I'm not going to have morbidity and mortality. Aha, that's amazing. I think that will work. So let's look at it. So what happens in real life is there's a patient and they start to get signs and symptoms of organ failure, and eventually they become pretty advanced in their organ failure. And then the organ is transplanted. So in other words, you take an organ from a healthy patient, and that organ or that tissue is a graft, and the donor is the one that provides the graft or the healthy organ, right? And then the recipient or the host actually takes in the graft and hosts the graft. Okay, so now the patient who was having organ failure is now a host, and the donor gives a graft or an organ to the host or the patient. Let's say the transplantation is successful. Well, they're not going to have signs and symptoms of organ failure anymore, because it's fixed. We fixed them. Okay. If it is unsuccessful, then again they'll have signs and symptoms of organ failure because now their organs don't work and the transplanted organs don't work, right? So let's talk about kidneys. So let's say you have a patient with chronic kidney disease. You had BUN and creatinine. That those are kidney function tests that are going to go up, right? The amount of urine that they're going to produce is going to go down. Other things that kidney produces, erythropoietin, vitamin D. Again, if you want to know more about it, take a look at my renal chapter and chronic kidney disease and anatomy and physiology of kidneys. But there's a bunch of things that kidneys do. Guess what? They're not as that organ fails, all of those functions are going to slow down and then eventually stop. If we replace their kidneys and we are successful, aha, things are going to get to working again. The blood creatinine is going to go down, blood urea nitrogen creatinine is going to go down, the urine production is going to go up, their vitamin D is going to be good, and they're going to produce erythropoietin, meaning they're not going to have anemia. If, however, the kidney transplant is unsuccessful, now not only their kidneys don't work, the transplanted kidneys don't work. Again, they're going to go back to the same state of organ failure. Okay? All right. So that's what it is. So now the next thing is, okay, what's the issue? Why would the organ transplant be unsuccessful? Let's take a look at it. Because if you're successful, this is amazing. Okay? So let's take a look. So again, let's take a look at it again. So you have the donor, right? Donor donates tissue. So you have a donor tissue. That's also called a graft. Okay? It's called a graft. And then you have recipient who is host and who is going to eventually host the graft. They get the tissue. Okay? So the big thing is that here's me. I'm the host. And this is the graft or the donor tissue. The host's immune system views this tissue as foreign tissue because this tissue does not belong to the host. This belongs to the donor. Donor is different from the host in most cases, right? So the host's immune system will look at this tissue and say, aha, this is foreign tissue. Now, if you've read through immunology, this should be very, very easy. When immune system looks at tissue that's foreign, what does it do? It mounts an immune response to kill it, clear it, and heal. That's what immune system does. That's its job. So if I just donate this tissue and put this tissue inside a host or a recipient, there's a high likelihood that the immune response of the host is, and you see these red arrows right here, it's going to attack this graft or this donated tissue and kill it. So now that's the problem. So can I do something about this? So let's see what we can do. So there's two things that we do in real life that we can do in order to stop this killing of the donated tissue. Number one, can we match the immune profile of the donor and the recipient? If we match the profile and it's really, really close, right? There would be less dissimilarities or differences that the immune system is going to see in the donated tissue, which means the less difference it sees, the less immune response it mounts towards this donated tissue. Aha! So, by matching, we are decreasing the immune response of the recipient or the host to the graft or the donated tissue. Secondly, for this low immune response, can we suppress it with medication? So now if you look under immune pharmacology, we have these drugs. So in DMARD, you've read about tacrolimus, sirolimus, cyclosporin, corticosteroids. So I do have some weapons in my arsenal that I can use to prevent this residual immune response, thereby preserving the donated tissue or the graft. ultimately that donated tissue or graft is going to help the recipient or the host by reversing the organ failure symptoms and giving them a lease on life and giving them a lease on productive life. Okay, so far we're doing good. We figured out what's transplant, how it can fix things, what are the issues, and how we can fix those issues. Now let's look at what are things I can transplant, okay? And this is the way I've divided it because I think it's going to help you. One can transplant solid organs like kidneys. One can transplant bone marrow and stem cells. One can transplant red blood cells. One can transplant platelet, fresh frozen plasma, right? And clotting factors. And then last but not the least, we'll talk about WBCs. Can white blood cells, can we transplant or transfuse white blood cells? The answer is no, we cannot. No, we cannot. Why is that? The donor white blood cell, so this is your host. So this is your donor, and this is your host, and this is the graft. So the WBCs of the donor, right, are going to recognize anything which is not donor and going to kill it, right? That's their purpose. If I transplant them in the host, what do you think they're going to do? This graft is going to attack the host because it's going to say, this is not a donor, this is not me. So the graft is going to attack. See how it's attacking the host? And that's called graft versus host disease, which we'll talk about a bit later. But that's why we cannot transfuse WBCs. We cannot transplant it. Okay, good. Let's talk about, remember, so we talked about matching. So when it comes to platelets, plasma, and clotting factors, these are not nucleated cells. This is not nucleated, so there's no matching that's required because nucleated cells have some special markers on them, and non-nucleated don't. So non-nucleated cells are going to get a pass, and they will not be tagged by the immune system. Red blood cells are special. Again, they have, the way to match them is to do what we call ABO, blood group matching. So again, for blood we have A, antigen B, and then we have something called a rhesus antigen, which can be positive. And so this is what I match when I am trying to match a donor to a recipient when it comes to red blood cell transfusion. Okay. Um, then we have two sets of transplanted organs. You have the bone marrow stem cells, and then you have the solid organs like kidneys and liver, those kinds of things. And if we have to match these two types of organs, I got to do two matchings. I got to match the ABO, the same that we did with blood. Additionally, I got to match something called an HLA antigen. And this goes back to anatomy and physiology. Remember when we had these MHC1 markers and MHC2 markers, and there were these three genes that hold the key, right? And you have these white blood cells that are CD4 and CD8, right? And so the concept is simple. I need to match these six genes, or these six genes that help me with development of MHC1 and MHC2. The more number of genes I match, out of 6. Again, this is human leukocyte antigen, or this is HLA antigen. And the more number of these genes I match out of 6, the better it is in terms of how well the graft will do and how matched they are on an immune level. So remember, we talked about matching them so that the immune response is low. These two things assist us in making sure that the immune response is the lowest possible. Okay? Fair. So this table will give you exactly what you need to do. So if I'm transplanting, transfusing blood, I'm going to look at AB. If I'm transfusing platelets, I don't have to match. If I'm transfusing stem cells, kidneys, I got to match the blood, and then I got to match a BO blood group, and I got to match the HLA antigen, or there's 6 things that I got to see that are matched. Okay, so on a very basic level, this table will help you figure that out. Now, remember this ABO blood group? Let's talk about how you match them. Okay, and let's do a little bit of work on this. It is less likely that you'll see it on the boards. Usually, what is seen most is the blood transfusion reactions are very, very common. But again, reactions are very common. And then also when we are administering blood, it is very important to do this matching part. So I think clinically it's important, maybe not on the boards, but a lot of schools have this on their test. So let's do it in terms of a problem. So the problem is, let's say we are given a question, can you give an AB negative blood type to an A negative patient? Okay, can we do that? Okay, now there's in your book, you're going to see a big table, and there are several references, and you're going to see big table, and the question is whether you want to learn that table. I've always had difficulty learning things. So what I'm going to do is I'm going to give you an approach on how to look at this. And if you do, you do not need to remember any of these complex tables. You can just apply these steps and you'll be able to match in real life and also on your tests. Okay, so let's take a look at it. Not to mention it'll help you learn principles, which is always good. Okay, principle 1, the blood group type lists the antigen that's on the red blood cell. So if I say somebody's got a AB negative, this is their blood group, or this is their blood type. That means their red blood cell has antigen A, antigen B, okay? And because it's negative, it does not have any Rh antigen. What if it's O positive? That means the red blood cell does not have A antigen, does not have B antigen, but it does have this Rh antigen. Okay? What about if it's A negative? That means the RBC has A antigen, does not have B antigen, and does not have Rh antigen. Okay? Good. That's principle 1. Principle 2. You can derive the antibodies that a person has from their blood group. So let's take a look at AB negative. Okay, that blood group has RBC has antigen A, right, and antigen B. So we know for sure it's not going to have antigen against A, and it's not going to have antigen against B. Sorry, antibody against B. So again, it's not going to have antibody against A and antibody against B. Why is that? Well, if you see that antibody will tag it and kill that red blood cell. So it's not going to have it. However, it does not have the Rh antigen. So there is a possibility, and there is probably an antibody against the Rh antigen. Easy? Yeah, easy. What about O positive? So this RBC has this Rh antigen. So can can you have an antibody in this person against the Rh antigen? No, you cannot. However, you can have an antibody against A, an antibody against B. You see where I'm going with this? So you can have antibody against all the antigens that are not there on a person's red blood cell. That's the basic principle on all of this. So from a blood group, you can get the list of the antigen that they have and the antibodies against what antigens. Okay, so let's apply this. So if somebody is A positive, okay, I want to see what antibody do they have and what antigens do they have. Okay, antigen, antibody. Okay, so pause the video and take a guess. Okay, welcome back. Let's see if you guessed correctly. So, antigen. My red blood cell has A antigen and it's got an Rh antigen. A and Rh. What it doesn't have is B. So it's going to have antibody against B. Antibody against B. Let's see if I got it right. Yes, perfect. So you have antigen against A. Antigen is A and Rh, and antibody against B. What if the blood group is O negative? Again, we'll do the same thing. So we'll do antigen. I know I reversed the antigen here and antibody here, but let's do it in order. Always start with the antigen first, okay? Because that's easy. What antigen would they have? Pause the video, put the antigen, put the antibody, and let's see if we are all on the same page. Welcome back. So O negative. That means it's not going to have A, not going to have B, and not going to have Rh, so it does not have any antigen. However, when it comes to antibody, it's got antibody against A, against B, and against Rh. Let's take a look. Ta-da! You see? Easy. Let's see if we have another question. Yes. What about if the blood group is AB positive? So you have again antigen and antibody. So that's step one. Whenever you're given a blood group, match it. For matching, get the antigens and antibody. So again, AB positive is going to have A antigen on RBC, B antigen on RBC, and Rh antigen. Now because it has all three, it can't have antibody against any of them. So antibody against nobody. There you go. Antigen, it's got A, B, and Rh. Antibody, nada. Now, last but not the least, what about B negative? So again, let's try it. So again, you have antigen and antibody. Pause the video, have a think, and then apply. And then let's take a look at the answer together. Welcome back. So antigen, B negative. So the RBC has B antigen. And again, it's got antibody against A, because A is not here, and against Rh, right? Let's take a look. It's got against A and Rh, so that's antibody, and then antigen is B. Perfect. You got it? If not, view the video again, do some more practice questions, and you'll get it, okay? So now you got the concept. Now, let's look at principle 2. Let's do the second part of this, which is what is the second step that I have to do? Again, I'm matching the blood group, the red blood cells. So remember, we looked at antigen and antibody of one's blood. However, when we talk about transfusion, we got two sets of bloods. We got the donor's blood and we got the recipient's blood. Okay? So the donor's blood, right? Think through this. So the donor's blood has antigen and it's got antibodies. The recipient's blood has antigen and it's got antibodies. Is that correct? Okay. Now, when I am donating packed red blood cells, I am giving only RBC cells or red blood cells. So I'm giving red blood cells. And those red blood cells have antigens on them. Remember, no antibodies. I'm only giving packed red blood cells. So I give somebody packed red blood cells with all the antigens. And again, I give the donors to the recipient. We good? Okay. Now, this donor's antigens are going to be right here. If the recipient has antibodies to any of these antigens donated by the donor, it's going to be killed. It's going to be an issue. It's going to be tagged and killed. So the principle is, take a look at the donor's antigen, take a look at recipient's antibodies. Okay, I'm going to repeat it one more time. When you are matching, take a look at donor's antigen and recipient's antibodies. If the recipient has antibodies against any of the donor's antigen, it's not a match. It is a problem because the recipient's antibodies are going to tag the donated donor's blood and the antigens on there and kill it. Is this principle clear? If not, stop the video, listen to it again. Okay, but this is a key principle, which is, and I'm going to repeat it one more time, the donor's antigen. Whenever we are looking at matching for transfusion with the red blood cells, the donor's antigen has to be considered along with recipient's antibodies. If the recipient has antibodies against any of the donor's antigen, this is not a match. We've got a problem, Houston. Okay, so now we have our three principles. We can, if you give me a blood type, I can get the antigen and antibody. That's principle 1 and 2. Principle 3 I've gotten, which is whenever I'm matching a donor and a recipient, I look at donor's antigen and recipient's antibody and make sure recipient's antibodies are not against donor's antigen. Okay, now that we're good with these three principles, let's apply the third principle and stack that third principle to do transfusion matching for red blood cells. So can I give AB negative blood to a negative patient? Let's take a look at it. So I have AB negative, okay, and I have antigen, so that's my donor, right? And then my host or my recipient is what? A negative, right? So you have antigen and antibody, right? And then I have antigen and antibody. Okay? So my AB negative, my antigen is A and my antigen is B. Okay? Can I do the antibody? Sure, but I need to consider donor's antigen, so I don't need to worry about it. You can do it. My host recipient is A negative. So again, we start with antigen, so it's got A. And then if it just has A antigen, I'm going to have antibodies against B and against RH. So my recipient is going to have antibody against B and RH. So because I have antibodies against B in my recipient and my donor has B antigen. If I give this blood to the recipient, these antibodies against B will tag these RBCs and kill them. So I cannot do this. You see, this is exactly what we did. Antigen AB, that's our donor, that's our recipient. Antigen antibody against B can't do it. Antibody against B will tag the B antigen on the red blood cell of the donor and kill it. Easy? I know it looks like some steps to do, but if you do it, you can do any problem that's thrown at you because you got the principles. So can you give B negative blood to B positive patient? Pause the video. Your donor is, sorry, so think about it. Your donor is B negative. So you have antigen and antibody. And your recipient is B positive, right? So you have antigen and you have antibody, right? Okay, now pause the video and give it another go and see if you can list down antigen antibodies and see whether this is going to work or not. Apply it and then play the video again and we'll come back together and see what you have. Welcome back. So if the donor has B negative, the antigen on the donor is B. It's not going to have A and it doesn't have RH. Okay. Do I have to worry about the antibodies on the donor? Not really, but you can do it. That's not a problem. Now the recipient has B antigen and has the RH antigen, which means it's going to have antibodies against A. Now if I give this blood, can I do it? Well, the antibodies in the recipient are not against any of the antigens in the donor. So the answer is yes, absolutely, do it. The answer is yes. Easy? Now, let's do it the other way around. Can you give B positive blood to B negative patient? Again, do not scrimp on the steps. Apply the steps and you'll get the answer. So again, you have your donor is B plus and your recipient is B negative. So again, you have the antigen, and then for the recipient, it's antigen and antibody. Why do I even do the antigen? Because the antigen is step one, which helps me get the antibody, right? So again, the donor has B and RH antigen. Recipient has B antigen, so it's going to have an antibody against A and against RH. Now if I do this transfusion, the antibody against RH is going to tag and kill the donor RBC. So I can't do this. So I can give B negative blood to B positive patient, but not B positive blood to B negative patient. But don't do this in your head. Apply the principles and you'll actually get the answer. Ta-da! Cannot do this. Okay, now, a couple of interesting points. O negative, right? Antigen and antibody. It has no antigen, which means it has lots of antibodies against A, B, and RH. That means if I give this RBC to any blood type, I am good because there is no antigen to tag. So this is a universal donor. Sometimes when we don't have time to match somebody's blood, we give them O negative blood. AB positive, on the other hand, will have all the antigens, okay, but no antibodies, which means it's a universal recipient. There's no antibodies. You can give whatever blood type to this person and they'll be good. They'll be good because they don't have any antibodies that will tag any of the antigens on any of the blood that is given to them, the foreign blood that's given to them. Okay, so that's just two interesting pieces of information. Okay, all right. I think uh, part one finishes here. Let's do a quick review of what we covered, and then we'll talk transplants more in the next video. So real quickly, we talked about transplant. What are we trying to do? What's the purpose? How it rolls? What are the issues with the transplant? How do we overcome those issues? What are different types of transplants and different types of matching that are required? For the red blood cells, we looked at matching the blood groups and determining whether a patient with a certain blood group can donate to a patient of a certain other blood group. And instead of tables, we actually looked at three principles. We looked at the blood group, which tells us the antigen, the blood group that tells us the antibody, and the key principle, which is that if the recipient has antibodies to any of the donor's antigen, this is not a good transfusion. This is going to be a failed transfusion. This is going to be a problem transfusion. And then we applied that to three different cases. Now, my suggestion is whatever you've read so far, apply and make it your muscle memory. And that will hold you in good stead. And then let's talk about the rest of the transplant in the next video.